In this episode, we're going to talk about hair transplantation, but specifically for people that are a diffuse pattern of hair loss. So stick around.
Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome back to The Hair Loss Show. Thanks again for watching and thanks again for subscribing to the channel. Please keep your questions coming. We really do enjoy having a look at those and certainly answering those in a video format. So to that point, one of the questions that we have been asked in the past is, well, I'm someone who is suffering from hair loss, but it's more of a diffuse pattern. Am I a candidate for a hair transplant? And that's a very open-ended question, and there's no clear-cut answer for that. I don't want to definitively say no. I think it is managed on a case-by-case basis. So let's sort of understand or get the foundations right. So male pattern hair loss is a progressive condition, and it's about the miniaturization. It results from the miniaturization of the hair follicles. And generally speaking, it follows a pattern, hence male pattern hair loss. And there's a classification, and I really don't want you to get caught up in the classification of this, and it's more for doctors who are talking amongst themselves. If I'm talking to a colleague about a patient and say, look, I've seen a patient who's a Norwood such and such class, like 3 or 4 classification. So there's a classification of hair loss, and it goes from essentially 1 right the way through to 7, with 7 being the more severe form of male pattern hair loss. Now, there's a separate category that doesn't fit necessarily within the Norwood classification, and that is what is in some circles known as DUPA, or diffuse unpatterned alopecia, which is where the hair loss, the hairline still remains, but the hair loss is sort of more generalized throughout the scalp. And so the hair looks thinner. So the question is an individual that has that sort of pattern a candidate for a hair transplant? Well, the first thing I'd say is, well, the concern is that there is a large area to cover. If you're looking at trying to create full density of hair in the entirety of the scalp, then potentially that can be problematic because there's a large area and because the pattern is more diffuse, and therefore the number of grafts that you're going to need is going to be on the higher side. And if that diffuse pattern is existing at the back where the donor area is, then trying to take a lot of hair out from that area is going to make the donor area, or the back of the head, look moth-eaten and threadbare. So there are scenarios where you may go, the person's got slightly longer hair, the way they wear the hair, there's the layering effect, but there is a portion in a particular area, maybe in the parting, that looks because of the directional change of the hair, that looks even more sparse or looks thinner and more exposed. And in that scenario, and it's a limited amount, you may do a smaller harvest over a larger area, and therefore come in and try and graft into that area and give that a little bit more density. So I think it's possible in a very sort of controlled manner, not going too big on the number of grafts. And then the second question we have to answer is the technique, how you harvest that hair. And there essentially in hair transplant surgery, there are 2 techniques. There's the FUT or strip technique, which you cut a strip of hair out from the back of the head, or there's the FUE technique, where you're punching out individual grafts one at a time. And I think in this scenario, really you're probably having to look more to the FUE technique, because in someone that has diffuse pattern alopecia, then with the linear scar, you're more than likely to see that in an area that's already got low density of hair. All right, so I hope you found that useful. Thanks again for watching, and we'll see you on the next episode. Take care.